So problem-solving therapy just teaches family caregivers or teaches individuals how to break down problems, define them, brainstorm different solutions, find one that may be doable. What do we have to do to implement that solution? And then come back later and after we've implemented it, evaluate it and see if that solved the problem. So it's a very simple problem-solving steps, but I think it's the coaching and having somebody there to help you redefine the problem. Instead of the problem is that my spouse plays the television too loud, we try to make them reframe it on how does that affect you? Well, I don't get to read my novel in the afternoons. So then that's the problem, and we'll find different solutions to that problem. And it's interesting because the focus is on the caregiver. A lot of people would like to focus on the patient with dementia or the vet with TBI. And my goal is to equip these caregivers with tools so that they can remain healthy and providing the best care possible to their loved one with traumatic brain injury. There's also some studies going on where we're finding that even vets that were not exposed, like did not have a period of unconsciousness with a blast-related injury, but they were near blast, they're finding changes in their brain. MRI scans are showing white matter changes. And so we're not sure what's going to happen, but these vets are at high risk for developing a dementia later in life. And so my hope is to just equip the caregivers with tools so that they can deal with their loved one who doesn't think like they used to think. The concern is that we would have to institutionalize our veterans with traumatic brain injury, and we don't want to do that. The family gives the best care. They're the experts. We need to teach them how to be caregivers. The longer they can care for their vet at home, that's the goal, because they provide the loving care. For me, for this study, I'll be looking at depression outcomes, quality of life outcomes, caregiver burden outcomes. But I think what I proposed is that the VA does not have any evidence-based services for caregivers of veterans. And so I propose this problem-solving therapy as an evidence-based intervention that should improve the mental health and well-being of these caregivers. And if it seems to be successful, then I would like to bring it to the VA to be adopted as an evidence-based intervention for these caregivers. I think there's a better understanding that TBI is a high risk factor for dementia. And we now know with our aging population, we have a huge population of older adults that are needing cared for. Now we have our veterans, our young people coming back, and they are damaged and they're at high risk for developing a dementia, but they also have these cognitive and psychiatric symptoms that are very hard for a family to deal with. If you are a caregiver, if you're a post 9/11 caregiver, you do qualify for mental health services. Pre-9/11 caregivers do not qualify for mental health services. After the caregivers have gone through an Elizabeth Dole Foundation Easter Seal training program, which is delivered in a lot of different modes, online, in writing, but it basically teaches the caregiver, how to keep the skin dry, and how to turn patients, and how to lift patients, and that's not necessarily what all the caregivers are dealing with. Some are, but some are not. So I'm just hoping that this will help give us a repertoire of services that we can offer caregivers when they do come and need help, when they are distressed.